Welcome back to the Good Back Podcast, where we'll be healing the spine in real time. All right, I just wanted to add a little message from future Henry, who is for the most part healed, sitting, mobile, out in the world. We've come here to this noisy Russian hyperbaric chamber just to continue on the healing journey, and there will be lots of exciting stuff like that coming up. But I just wanted to say that this episode is a combination of episode 2 and 3 because Damien could not make it to episode 2. I have included one scene where the practitioner is talking about muscle recruitment, where we can see on Henry's back that there is muscles being activated by the EMS machine, so the electric muscle stimulator, that should normally just be pulsing in one specific area, but on one side of my body, so on the left, we'll see that the muscles are acting normally, and then on the right side of my body, there's muscles being recruited, as they call it, triggered by a stimulus for a different muscle. So that is one of the things that got sorted out over time, and it started to correct the imbalances. And now here I am out in this crazy world of healing and healing devices, working on the video that you see now.
It's quite nice to actually, like a depth charge, it's kind of nice to use both. You can hit that one and then hit that one.
Right.
So that's 3.5, that's a kind of 1 megahertz. Mm-hmm. Kind of general sort of thinking, how really scientific it is. But anyway, but when I use 3.5 megahertz frequency at just the 2.5 watts, it doesn't really seem to do the job. At 3, I can see this really making a good difference. Okay. So I only just found out yesterday your machine does 3.
Yeah.
So I'm kind of thinking we will start with one half of your back at 3 megahertz, which is the one that doesn't go too deep.
Yeah.
But everything's going to be on the full power of 3 watts, 5 minutes in each side. Then change the frequency to 1 megahertz, and then do 5 minutes and 5 minutes.
That makes sense. Okay.
We might not get very much difference from what we did yesterday.
Mm-hmm.
But it actually just might be, just you never quite know.
Yeah.
And this, in my head, this kind of covers, because we're covering the ground area-wise, but it also helps us to cover the ground depth-wise as well.
I hear you there. And just a quick report. So we are filming now, and I would say that as I gauge my recovery in the millimeters, I have noticed significant millimeters after yesterday.
Wow.
Yeah. Last week, I could only walk 10 feet. I've been sleeping on this inclined bed and stuff. I can now walk easily 40 feet. And I've started to, when I'm walking, especially yesterday after the treatment, I felt so energized in my ability to stand on my toes while walking. Yeah.
Really good.
Yeah.
And I think the other thing, even if you're in that position now, people watching and having watched the earlier videos, mm-hmm. you can tell from your voice and the movement of your eyes and the speed, it's not labored. You're not, pain isn't slowing you down. It comes across.
So, I've stopped taking naproxen as well. We'll see how that goes, but at least for now, I missed enough of them just because I wasn't paying attention that I figured, okay, it's out now. Let's let it happen. And then I actually missed my gabapentin last night by 2 hours. I ended up taking it because I know you can't just come off gabapentin. But I just all of a sudden realized, oh my gosh, I haven't taken it. And normally I'm waiting like 5 hours for the gabapentin, and I'm like, oh, finally, and then I take it. So little improvements, and we'll just
it's quite a nice scene with some of my patients is they hobble in with walking sticks into the clinic, and then after a couple of sessions, I sometimes have to chase people down the road with mobile phones or earrings or necklaces that are left behind in the therapy room. And it's quite nice to have to chase them down the path with their walking stick because they forgot it.
Yeah, that's
don't feel like it. So that's a nice problem to have.
That's awesome. Yeah. Okay, so we are applying the gel. Are we gonna have enough? Do you think? The new one should be here. The new one will be here on Tuesday, apparently.
All right. Well, tell you what, just do one side for the time being. It dries up while you're using it, so we'll just do one side, so you won't have to apply any more later. and then we'll do the second side. So
Okay.
we'll just start with this
Use this to move
left-hand side.
You
So
can,
what we
or you can
did
get a spatula,
was
it's a little one.
just to let you know what the new protocol is, and I say new protocol. The wonderful ultrasound machine that we have doesn't just go up to 2.5 watts per square centimeter. It actually goes up to 3. Now, with 3 watts per centimeter squared, I actually find I can get really good umph with the 3 megahertz, the kind of surfacey one. It's just, if it's 2.5, I'm not really doing very much. At 3, I'm releasing good results. So what we're going to do is, because the machine can go to 3, and not a lot of machines do 3, they're usually max out at 2.5. Because I thought it was a 2.5 max out, which is quite standard nowadays, hence we'll be using just the 1 megahertz frequency, which goes quite deep and gets a wonderful job done, as we're seeing here. So this time we're going to go for 5 minutes of 3 on both sides of the Mac, and then 5 minutes of the 1 megahertz, and all at power 3.
So that's,
and we'll,
power is here, watts per centimeter squared. So always we're going to do 3 now. We're doing intense treatments. But here he's talking about 1 megahertz goes deeper, 3.5 goes shallower. So instead of doing just the one setting and a 10-minute on one side, 10-minute on the other side, we're now breaking that into 4, and we're going to do 5 minutes on 1 megahertz, 5 minutes on 3.
And it's still going to be pulsed to 50%.
It is pulsed, duty cycle 50%. So yeah, program U01, 3 megahertz, 50% pulse, 10-minute timer. So we can change that to 5.
Yeah. Oh, we have the spatula to spread the gel.
Finally, yeah.
Great idea.
Yeah, dedicated spatula. I should mention I slept an extra hour last night. Yeah. So that being said, though, I passed out pretty hard, and so when I woke up, I was in a bit of a flare just from sleeping funny, but I'm used to that.
So the
It's
show
not
started.
on yet, is it?
No, it's not on yet.
Okay.
Oh, okay. You just been a bit of spread. Okay.
Yeah.
Yeah.
But I think, in the future you can do it with the spatula.
Well, I don't know. This just works way better.
Okay. Are you ready to begin treatment?
Yeah.
Okay, so we're going up to 3. Here we go. Three watts per centimeter squared.
Okay, we are rocking and rolling.
Yeah.
So his skin is peeling a bit. Is that normal?
You know what? I didn't have a shower yesterday. I bet that's old ultrasound gel.
Okay.
Oh, right, just the old gel coming off there.
Yeah, I noticed that actually. What is ultrasound gel? Is it it's an electric?
Yeah, it's this mix of arsenic and cyanide and the water.
Yeah.
It's a water-based. It's a water-based gel. I think I don't know what's in it, to be honest. It's either some sort of flower-esque thing or some sort of. But I get the one that is clear. You've got a slightly blue one.
Oh, okay, I had the option.
And then there's one that's scented, I think, because a lot of this stuff is sold to beauty parlors. So I get the unscented one and the plain one, because that's how I like to do it. It has the disadvantage of that one of when you're scraping it off, you're more likely to miss a bit.
Right, that's why I went with the blue. But good to know.
Drive home, and you realise there's something gone down the back of your shirt. It's so different. So the blue one is better for cleaning off. But I kind of like if I can avoid a chemical.
Right.
That's my take on it. And,
so I think I'm noticing a different drag today. Drag in different areas, and especially down around my glute there. 3 megahertz, yeah.
3 megahertz, okay. So that's more surfacey.
Okay.
So that is it, and yeah, I wouldn't be surprised if you're feeling different. Now, one of the things about the word protocol gets used. It's protocol with slight inverted commas on. If I'm working on a patient and I see them responding very well to a particular frequency, then I do more on that frequency type stuff. So you kind of, if you're sitting there after 5 minutes and you go, wow, that was so much better than the one yesterday.
Yeah.
Then we'll do another 5 minutes on this side with the 3 megahertz. You kind of you do be a bit of a therapist. If you stuck to a color by number protocol, you still get the job done, but it's all you gotta adapt a little bit to kind of like parking a car. You gotta pay attention and vary it accordingly.
And I'm glad that I can feel the feedback that the therapist could also feel through the device. It's kind of a two-way
Yeah.
street there where we both feel it. And so when I'm healed, I'm very excited to take these machines out and look for the same feedback on my friends and other people.
Yeah.
Yeah.
What should we talk about, Rand? Shall we talk about Dr. Sherwood?
Yeah. I'm learning bit by bit here, so I've got the edit going, and I'll have to like take your picture and put it in some videos, and we'll just mix and match because
Mix and match. Yeah.
but it'll be good.
Oh.
And I was playing around with a little bit of a before we start on Sherwood here. I'll just show you this real quick. Welcome back to the Good Back Podcast, where we'll be healing the spine in real time.
Hey, I like it.
It was my first attempt.
There we go. Right, a little bit lower.
Yeah.
That's all right.
Okay. Here we go, Dr. Sherwood.
Right, so Dr. Sherwood was writer of this book and also this book. This is his back book. This is his front book. This shows you how to fix your back and everything associated with the back, because along the spine you have the hardware for the sympathetic nervous system, little ganglion they call them, and they're mini brains basically, and they control the process of your body, the repair of your body, and it's why when you chop the head off a goat or a chicken, they can still run around for a few minutes, because there's actually not everything goes from the peripherals and the system to the brain to be processed and come back again. It goes to the spine and it's processed by these junctions, these little ganglia, are not there to amalgamate the information and send it to the brain entirely. They'll actually process the information and send the signal back, and it'll never get to the brain at all. And the brain's got other things to be doing. And when your spine is, they are called anterior to the spine, just in front of the spine. And when your spine's got a problem or had a trauma injury, and then the whole thing's seized up a bit, your muscles either side aren't moving. And when your muscles on either side aren't moving, and moving is a compulsory activity for human beings, it's not an optional extra. Those muscles don't act as a muscle pump to clear out the lymphs, because the lymph doesn't have a heartbeat. There's twice as much lymph as blood, and it relies on you moving. So the area gets stagnant and basically becomes a bit of a toxic swamp. This then means these ganglion don't function properly, and or don't receive signals properly, and or don't deliver signals properly, and all sorts of things happen when that happens. And so he's saying that not only can we get rid of back pain, and not the other interesting thing about this is not even back pain. So, for instance, we have patients come in, and Dr. Sherwood had patients come in with back pain, and he fixed their back pain, and then they say, my migraines are gone, or oh, my period pains are gone, or my digestive system's working, or I no longer have chronic fatigue syndrome. So then he did what I did, and because what I'll talk to my patients about, my patients will generally come in with a back pain, or they'll come in with scoliosis. But when they do come in, they'll come in with a father, a driver, a husband, wife, whatever, brother or sister, some friend or relative. And that, while I'm chatting about the sympathetic nervous system and the problems it can cause, not uncommonly will they say, well, actually, I have migraines, or I've got this problem, that problem, but I don't have back pain. And I say, you actually, when you have a bad back, it doesn't mean to say that you have a painful back. You can have a sub-painful bad back. So it's bad, it's congested enough to mess up the sympathetic nervous system, but still not bad enough. So it's only painful really when it just happens to sit on a nerve. So you can have that situation. So then they say, well, can I have a go? So I said, yeah, go on. And we give them a bit of a treatment, these people who do not have back pain, but have these other problems. And, their migraines go, the period pains go, the digestive system goes, the stomach ulcers stop, all this sort of thing happens. And so there's an awful lot of stuff that fixing a back does. And again, you look at the data, the science in this. When you go to analyze data, and they're looking at, migraines, for instance, and they will, ask people lots of questionnaires, And a lot of it's about trigger, what triggers a migraine rather than what causes the migraine. And one of the things will be in it, do you have a sore neck? I would suppose. Certainly a lot of them do. And a lot of people will say no. In fact, it might only be that 10 or 20% say yes. And 10 or 20% out of all these people who have migraines, they'll look at, people have sore necks, they have sore necks, but they have migraines independent of a sore neck. But so according to the data, having a bad neck, because having a bad neck by the data is what the individual has said is a bad neck, and that basically means is a euphemism for a painful neck. So when I have a look at the neck and I go, and you can see sometimes it's kind of like the C7 is sticking out more than it should do, and you can feel it's congested in the area. And I would mark that down as a bad back and a bad neck, and then I'd fix it and the migraine would go. So sometimes I look at the academics and they're analyzing data and they're sticking all these huge amounts of data into AI processing the thingamajigs. As the AI's got bigger and the analysis ability to kind of crunch numbers has got bigger, the phrase I used to hear many years ago, I haven't stopped hearing, but it's still very much valid, which is garbage in, garbage out. That if people are saying I don't have a bad neck, and they tick it off on the box, and that becomes data, that becomes a metric, that becomes, the gold standard that you can't touch this. But actually, pretty much all of them have got a bad back and a bad neck. So so not only is it back pain, it's also loads and loads of other problems as well. So one of the things is, whatever your problem is, one of the things I say to people, Google it, your problem, and then Google sympathetic nervous system or autonomic nervous system, because the autonomic nervous system is like the automatic one, the one you don't think about, it happens for you. The autonomic classically consists of the sympathetic nervous system and the parasympathetic nervous system. So it's the two combined. And for all practical purposes, in terms of this sort of problem, the parasympathetic consists of the one nerve, the vagus nerve, vagus meaning wandering and wanders all over the body. So Paul Sherwood, he was a consultant at Bart's Hospital in London, one of the big famous London hospitals, and he was pronouncing medical terms is always fun, especially on live video. Let's go for this one. An anesthesiologist.
Yeah.
He sort of knocked everybody out and kept. But
anesthesiologist.
Anesthesiologist.
Yeah.
Thing. And he got interested in bad backs. He didn't say exactly how. I think the patients are saying, we've had operations. He's seen operations and stuff, and they're not getting any better, and they're getting worse. And so he basically is a very, very, very clever chap, and he had to think about it. Presumably had to read, asked around different people, and then started to try different approaches. And he examined the back physically. He looked at the back and go, okay, this bad back looks congested here. It looks stagnant here. I wonder if that's got something to do with your back pain. And let's get rid of the bits I can see. And then, okay, how do we do this? Well, I don't know. And he said, I know. Why don't we try this? Why don't we try that? Why don't we try? And he tried different frequencies of ultrasound, different frequencies of the EMS. Probably tried lots of things.
Okay.
Found these two things work.
Speaking of which, we are on 1 megahertz now.
Right. And he had this place in Devonshire Place or Devonshire Square in London, and he was fixing huge amounts of people, and some of them very famous as well. In fact, he treated, I think, pretty much the entire band of Queen, and the Brian May did his wrote and read the eulogy of Paul Sherwood's funeral, and so he treated lots of famous people and rarely name dropped because of client confidentiality and stuff. But he was a top known bard, and a lot of newspapers and magazines would have articles written by him about various health topics, which he had a lot to say on. So this book absolutely packed with all that kind of stuff. And then this book is his front book, and by his front book he talks about blocked lymph nodes and stuff causing a whole host of problems, and how to fix them. And
With
they
ultrasound.
and again, he essentially used the same technique. He uses EMS on the lymph nodes, and he uses ultrasound on the lymph nodes
How
to
is he
kind of break down
diagnosing a blocked
the
lymph node just
gritty
by
stuff.
touch?
And people with all sorts of problems were getting better. A couple of examples. He had badly behaved children. He had kids who were just getting into trouble all the time. And if you kind of get a classically badly behaved kid, and you get them to turn their head that way, and you can see, sometimes even see little dried pea level things along the neck here. And when you have that sort of, and if you can't see them, you can feel them. And if you can feel that, then what's happening is the lymph nodes here are blocked, the lymph drainage is blocked, and you'll end up with basically what they call cerebral, means head, edema, which is kind of build up of fluid, because the brain isn't draining. And so the basically, I mean, children, I don't know what the euphemisms are in Canada, but often when you get a very badly behaved kid in England, the other kids will call him a head case, because there's something wrong. You know, he's, and it's almost like they've spotted there's something wrong with his head, and there'll be an edema in there, in many cases, and it basically gets often just with these things, just 5 minutes a day of massage, dry, just to break down those things. He was finding the kids are getting better. And the behaviours and it's their concentration, not in a bad temper all the time. And where that isn't working, then a bit of the ultrasound and a bit of the EMS will help break that down and kind of pump out those lymph nodes, and that was getting them better. So that's what the second book was very largely about. So then, as time went on, they invented, they being somebody else, invented a wonderful machine. It was Robert Taylor, and a mate of his as well. They invented something called back then they called it the PAM, the Power Assisted Micromobilization Instrument, something like that. And later on, is now called the ASMI, the Advanced Spinal Mobilization Instrument. And Dr. Paul Sherwood started to use this on top of these therapies. And so basically and I got to know about it. So what happened is an osteopath in London, who sadly passed away a couple of years ago now with a heart attack, following a hepatitis vaccine. She got worse and worse and worse for months afterwards, and then had this heart attack. She was doing her osteopathic back cracking, and her back was so bad. She said, if I did 4 patients, I'd have to go to an osteopath to get my back cracked, and I was just going nowhere, and it was getting worse and worse. And she went to Dr. Sherwood for some treatment, and he gave her this treatment that you're now getting, and she's like, including the ASMI machine. It's exactly the same machine. It is exactly the same machine as the PAM, but it's like the American. It's now sort of an American company, and that they've chosen to use the ASMI word rather than the PAM word. And so then what happens is she's like, well, that's amazing. And Paul said to her, he said, why don't you use this therapy yourself instead of doing all the back cracking? It's far more effective. So she said, jolly good idea. And so she did. And then I, as a patient, was fortunate enough to be recommended it by somebody else. And I went down there, and my back, my scoliosis, which is my back, my head here, my back kind of came down and disappeared behind my shoulder blade. It took 8 sessions to kind of, the PAM machine, as it was, the ASPI, as it's now called, to kind of straighten my back.
Amazing.
And so I said, well, why does the world and his wife not know about this? And they were saying, well, the osteopath was saying, well, the people who invented it, Robert Taylor and co., they were engineers, and they came from outside of the medical profession, and they were basically approaching, this is what she was saying to me, fixing the back as if it was an engineering problem, and they were kind of fixing a vertical bridge. You'd have to kind of have certain principles, mobility being very important. One of them worked as a bridge engineer, and one did aircraft wings, I understand. this is all my all secondhand information here, so who knows if exactly correct. I think it should be. And where they were looking at it is if you have an aeroplane wing or a bridge and it is rock solid, your airplane, complete, it's going to give you nice, wonderful stability, and one day it'll snap off and the plane will fall out of the sky. Same with the bridge. If there's no movement, micro movement in the bridge, it'll be nice and solid, nice run, and one day the whole lot will go. That you need a little bit of movement to absorb all the shocks, and the things go on for ages. And basically, when you have a bad back and it all kind of freezes up and mobile and it gets stiff from all the spasms around it, then eventually the whole thing, just as an engineering idea, this isn't going to work. Something's going to break somewhere, and then your back pain comes a bit later. So their attitude was getting the vertebrae that will normally move like this between each other when you're moving, a little bit of movement, and they're jammed solid. Their machine puts pistons either side, powered by compressed air to give a really nice smooth. They restore that sort of motion, and so when a shock comes through, by shock, walking, moving, and kind of every time life, instead of it being bang bang, it's a little bit of and absorbs the shock, and so the things don't wear down and break. So because they came from outside the medical profession, from the engineering profession, the medical profession, the way it's set up, is there is no front door where you knock on the door and say, look, I've got a good idea. Everything comes from within the medical profession. And I think was it, I'm going to say Linus Pauling, but it could have been one of the other 1900 scientists who said, science progresses one funeral at a time. And, it's not just the medical world that's like this. The whole medical world is based on the reputations of great scientists. And if new things happen, or new discoveries happen, and it doesn't match this edifice that's been built up, basically they kind of wait till the guy dies and he's slightly forgotten, and the new brigade come along. So that they were basically talking to the hand in terms of getting anywhere with it. But that was before social media. And so when I came along, it was a year or so after Facebook started. And I'm not really one for video games and that kind of stuff and computers. But I thought, let's use this Facebook stuff and YouTube and let the world know about it. And the idea was, I'll let the patients know about it, and they'll ask the doctors for this treatment. And it happened a little bit, and the patients were like, they said, okay, I've got scoliosis, back pain, where do I go? And I sent them to the handful of therapists around the world who were largely in England, but some had spread a bit abroad, who used the technology. And then what happened is they, over there, worked okay, but not, now and again they'd mentioned it to their doctor, their GP, or their consultant, and the answer from them was pretty universal of, I've never heard of this, and there was a tone of voice of, how dare you talk to me about anything, everything that doesn't come from the pure ivory tower. There's a sort of attitude.
And I experienced the same thing even with Stuart McGill, as we discussed. So
yeah, and it's an academic. It's what they train you in. There was an article, a comedy, slightly comic article read years ago by, might have been Stephen Fry. It was something about when people get on a graduation ceremony, it's almost like they suck the brains out of them, so they've stopped where they are, and it was something like this. But it seems like that's like the natural curiosity that somebody who was interested in these things that would have when they went into it in their late teens or early 20s. By the time they've come out of it, that's gone, and it's not allowed to exist anymore. You have to go through the routine. I mean, there's a numbers game that goes on with this. They talk about science. They borrowed the phrase from religion. There's a little phrase that they use in the Church of England that the wheels of God turn slowly, but they grind finely. And science kind of borrows the same thing. Science might go slowly, but it does a really good, detailed, proper job. The problem with that is, or a problem with that, is if you were to get a pack of cards and then chop them in half and chuck one away, put the one half away, just leaving just over half, 28 cards, mix them up, and then put out half of them, 14 cards. And what I'm talking about here when doing these 28 and 14, 28 in my head is like of all the metrics you might want to look at a particular topic. Okay. That might be available in a particular topic. And 14 are the metrics that make up the key, that make up the issue that you're looking at. So it needs to, to run a car, you need to have petrol, and you need to have oil, and you need to, you have lots of things, not just one thing. Mm-hmm. And the question is, what things are they, and in what order does it happen to get something to happen? And the thing is, the combinations of 14 cards out of 28, it's something like 1 times 10 to the 18. And there's actually only 1 times 10 to the 17 seconds since the universe began. That doing this wheels grind slowly malarkey, we will check one at a time, we'll change that variable, and without using intelligence on top of it, basically Academica can go on forever and never find anything. And they'll always be doing the scientific method of testing that and changing that thing. And if they're not open to proper experimentation, which they don't appear to be, something from outside of the field, mm-hmm. then, basically, literally, they will never get, by using that method, to this answer that works if they're going to use their technique. Right. Of let's try this thing, then let's try that thing, then let's try that thing. So Paul Sherwood continued on working and treating patients, and he died when he was 93, and he was still working and doing an amazing job. And sadly, outside of me and his patients, I never actually got the opportunity to meet him, but I know people who have, and some of his old patients have come to me, mm-hmm. and have been very useful in giving me. He said, no. His book says one thing, right? And he said, no, it's not in his book, but, and that's been very useful. And particularly with the electricity, he was saying that what he used to do is he got people to lie on their back, and they used a cushion, and so the back would push up against this cushion, and they had the pads here and then the back here. Just A, it took the stress out the paraspinals, and B, it sort of like pressed against the thing a bit better. Yeah. So, but he wasn't using these sticky electrical pads. Don't think have been invented. Go on, yeah.
Oh, I'm doing it. Yeah, I'm just showing. Yeah.
Okay.
So there we are, and going up. Okay, continue if you like.
Yeah. So, and it is amazing work has been forgotten, but the problem is with the work he's done. Being effective, it's wonderful for the patients, but you can't make a big money out of this, because you can't send it to China to be reproduced on a mass scale at a penny each and sell it for 2 pence each and make a fortune. You can't scale this terribly well. These therapies last an hour to 1.5 hours. The physical skill level needed to do it is, it's less, as you can see at this level. The ASME requires more skill, but this is the level of, very, very basic thingamajigs. How do you, as a racehorse owning spinal surgeon, maintain or replace your income with this therapy, which, and you can be, I'm going to say a hairdresser, but actually there's probably more skill in doing hairdressing and getting a cut right, mm-hmm. than putting these pads on. And just, it's quite a basic, it's little more skill than, I don't know, doing the laundry ultimately, isn't it? You put your powder in the wash, you do your spin, you put it out to dry, you're just doing quite a very basic technique. And the problem is the world ultimately runs by cash. And so it's there's no big driver to push this therapy from the producers, from the suppliers' neck of the woods, because they're not going to make huge amounts of dosh from it. And the other thing is, it gets the patients better very quickly. So that in terms of when you do chat to osteopaths and chiropractors and physiotherapists, their conversation will often be about this concept called patient retention. How many of your patients do you keep for how long in months? This therapy is wonderful for getting people better, but it's terrible for patient retention. It really. So it's you have to have a certain turnover, and a lot of their business models are about sort of like spending a lot of money on advertising to get the patients in, and the first 3 treatments are paid for by pay the advertisement, and then having got that, you don't want them. A lot of the people like I'll fix in 3 sessions, so there'll be no money if I use that model. So ultimately, the ultimate driver has got to be to get this therapy done. The ultimate driver has got to be driven from the patients, the only interest group who have an interest in this therapy. And in fact, a lot of the therapists who do this are ex-patients who've gone, right, this works, but we need this. I suffered so much. I can't sit by and let other people suffer like this. But it won't make it big mainstream until people, the customers say, I'm not having back cracked. I'm not having me back split open. I'm not putting me leg in this position over here. And I'm not. I don't need hypnotism.
Can I ask you a quick question, Damien?
Yeah, far away.
So if you notice right now, my left glute is firing much harder than my right. So when I do the squeeze function, it sends me to the left. Like right now, boom, left, right?
Oh, yeah.
Or to the right, sorry. And so yesterday I was saying potentially I should be in my brain also actively engaging the same muscles that the machine engages so that I have both stimulus from the brain and the electronic device. Do you have any thoughts on that? I could push it back over, right? Like this.
Yeah. Now he is a kinesiologist.
Correct.
And that field actually doesn't really exist in England in England, a kinesiologist is an alternative practitioner. The word is used.
Mm-hmm.
There's somebody who gets you to hold your arm out, and they do these muscle testings, and I'm going to be slightly facetious now,
mm-hmm.
and they'll put a peanut on your head, and they'll see if your muscle goes up and down, and it actually they get some interesting answers actually. Mm-hmm. So I don't think it's entirely a fake stuff, but I don't do it, and
okay.
If you want to go. There must be a branch. I think my understanding of the way she was chatting, even physiotherapists in England don't talk about it's all about this muscle activation
mm-hmm.
At a kind of single muscle level.
Yeah. I mean, I see
there's no flutter
pulsing over here.
It's pulsing there, no flutter on this side, but this guy is trying to help out.
Okay.
This like kind of striation through your rib there.
Right.
Yeah, this section here is like if I move the pad cord, and you might not be able to see in the video, but this section here
mm-hmm.
is like
it's just like a baby pulse. It's pretty hard to see.
Yeah, but when the big squeeze happens, like right there.
Oh wow. Okay.
And it sucks my ribs in.
And when it should be firing similar to this side.
Right.
And I don't even hear English physiotherapists talk about that. So it's almost like a field that we don't have in England. And it's very, listening to is fascinating.
Yeah.
So my answer to that one is she might be right. But I haven't done that with my patients. And I just say, let it happen. But I'm open to some change on that one.
Mm-hmm.
But I don't tend to, I do have this thing about therapy is I don't like exercise as a therapy for a million and one reasons. First off, a top ballerina, the Darcy Bussell or Natalia Osipova, when she's training, she spends half the time getting told off by the trainer for not putting her arm in the right position, or top ballerinas doing top ballet get it wrong most of the time.
That's a great point.
And when you're in pain with a bad back and your back's over there, you can't even see it half the time. Are you ever going to do these things right? And even when Stuart stuff, he's talking about you build up the kind of gently, and he talks wonderfully stuff, and for lots of people it works, but you build up so slowly kind of like a brace, and then you do that kind of like the adjusted curl, which you come up, you don't come up.
Yeah.
If your muscles aren't firing on one side, and like some of yours have got problems, and Anna's pointing simply you're firing and non-firing muscles out, and the brace doesn't happen, and you try that. So even if you are trying your best to do it right and your nerves are all trapped. So I think, well, so the problem with that.
I relate to that.
Yeah. And the other thing is, so most of my back pain patients, if they got on the floor to do any of those exercises, they couldn't get back up again. You know, the granny's in absolute agony, not going to go on the floor. But I think the thing I think's best about Stuart McGill's work, and I really love and I use, is his spinal hygiene. So the basic thing I say to the patients is, I do the therapy to get you better, or I do the therapy to clean the system so your white blood cells can get you better, and your job is to do the Stuart McGill stuff at home in terms of the spinal hygiene, so you don't bugger it up again.
Right.
Like you don't pick up something with a silly twist and you don't get out the chair the wrong way. And using that technique, it works. And so if you get something that works, the only reason to change it is to say, well, can you do it even quicker? You know, and if you so a little so this works, and I wouldn't be, because the other thing is when you're not well, and if you've got to do this, remember to do this. And if I say, okay, let's engage that muscle, and then somebody watching this starts to try and engage their muscle they think isn't working properly, and then they end up doing the other one, which pushes the other way too, even if it's good for you, are you ever going to get the right muscle to engage right all the time? And I just think, you know, I tend to go, let's keep it simple. And there's...
Yep, I think that answered the question quite well. And just before we go back to Sherwood, at this level, so I'm up at 30 now today. I just went straight up to 30.
Wow. Okay.
The first level was fine, but this level, it's also fine. But I do notice a slight bit right on my tailbone. So right here, I guess.
Yeah.
A slight bit on the contraction.
Breathe, yeah.
I just feel a little bit like, I don't even know how to describe it. Like, just the tailbone, I don't know if the current's passing through it or if the squeeze is causing it to, it just feels like proud and firm or something. It's an interesting sensation.
Huh.
Yeah.
If you feel two things, if you feel it irritated, then reduce the power.
Yeah, no, I don't feel that.
As I can see now, on the right hand side, because your kind of back goes a little bit up, a little bit then down.
Yeah.
And the stickiness in the pads is coming off a bit.
Okay.
The left side has got it pressed down. The right side doesn't. So
okay, Chrissy, can you please
your tailbone? Now go towards your tailbone, the center of your body. There. That bit was sticking up a little bit.
Okay.
Oh.
And now it's pressed back down again.
And
this is one of the things, as great as this Globus machine is, the pads they give you on the first go, they wear out a bit quickly, and hence we've got on the link to the on the Good Back website, it tells you what pads I use that last, and you make them a bit damp to revive them and the backup.
I'm having a heck of a time with their customer service right now. I will call them out on this podcast slightly, because I've sent 5 messages to different things and not heard back. The last message I have from them says your payment went through and we have processed your order, and now I have not heard anything since. From what company is it? It is HCW Health.
Okay.
Yeah. Okay.
They do, the pads they do are amazing, but I don't know if you could be the first time they have sent anything abroad.
It's possible.
And if they are, because often they'll use agents to send and they all press up. In this modern world, if you send something abroad really quickly and put their address on and put a stamp on, and if you don't have all the paperwork backed up, it could get stuck in customs. So they might be sitting there going, "Oh, I better check this with so-and-so." Okay, so that is, in fact, that is a. If you're used to exporting from one country to the next, your agent will sort all the paperwork out.
What I'll do is, when the pads arrive, I'm gonna look at them very intently and figure out which manufacturer is producing them, probably in Asia, right? And then I will find another brand on Amazon that produces those same pads. But it's possible HTW produces them as well. Yeah.
So easy to
Yeah, I've tried all sorts of pads, and they are by a country mile the best.
Understood. Yeah.
And but if we come across a new one that's good that the Canadians get hold of better, yeah, let's
Yeah, we'll see what we can find. Okay, so where were we on Sherwood? I could rewind the tape, but it's probably better to just try and remember.
Yeah, so basically, so he set these things up, fixing people all over the place. Was right royally ignored by all the other doctors, despite all the amazing stuff he was doing.
Mm-hmm.
So the worry was, even with his fame, this technique didn't take off. So hopefully, so I'm thinking, what chance do I stand if this is Doctor? You could say, if you ever went to the Queen's Tea Party and you'd say, and you mentioned Dr. Paul Sherwood, she probably had treatments by him, and she'd know, he really was famous, and especially in the world of the celebs and stuff.
The elite.
And now it completely didn't pick up, completely forgotten, and needs to be the standard treatment that anybody with a bad back knocks on the GP's door anywhere around the world, and you go, nurse, fix this person, and they'll go in the other room and they'll get this therapy and they'll be fixed, and they won't have the years of life problems. And what we have now that Paul didn't have, he had books and newspapers, and we've got and contacts with the royal family. We've got social media. We've got YouTube and Facebook, and lots of people with lots of bad backs who, when they see what's going to happen to you, will get. And one of the things that there's a scene on one of those Marvel movies recently where the Incredible Hulk is David Banner, and they need him to be the Hulk to have the fight, and he isn't, and there's all the armies charging up, and the fella says to him, he says, how are you going to turn at the Hulk if you're not angry? And he looks at him and goes, I'm always angry, and turns into the Hulk. And I thought, that sounds like me. What drives a lot of what I do, despite the fact that I might sound pleasant in bits and pieces, I'm really, really, really angry about how I was treated or not treated when these treatments are available. And I see that in all the other patients all around the world. And I'm on lots of Facebook groups and stuff.
I see that in the practitioners too. It's totally the case, yeah.
And so for me, it's like a controlled anger. And I think I want basically other people to see this. And, the phrase, and in England, you probably have the same thing in Canada, that there's an awful lot of people who, when they say a doctor gets mentioned, they make a noise beforehand, and they go, oh, doctor, and basically means your mind is switched off and you're going to obey this white-coated thing. Basil Fawlty did the same thing in Fawlty Towers when the doctor arrived. He goes, oh, doctor, it's that sort of level of sycophantasy, if that's a word. Anyway, haven't adjectivized that very well, have we? I need people to be not deferential anymore and say, and not go, well, please, doctor, have you look at this. I need them to go, hey, look at this. For 15 years I've been in agony, you've given me pills. You could be fixing me like this.
Yeah.
Why haven't you not done this? This book was out 20 years ago. You tell me, I come to you, you're made with the top expert in the world, blah, 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 and get angry. And maybe even in America, get legal. If you've done an operation and they didn't need it because they could do this,
right?
They will listen when the racehorse has to be sold.
Well, that might be a big part of what we're seeing here as well, actually.
I mean, do we need? I mean, I like to be nice, but if for 20, 30 years, knocking on the door and being nice to the doctors and asking politely has got you them racehorses and flashy cars, and you a life of back pain and early death and divorces and all sorts of and utter misery and addiction to the fentanyl, and then withdrawal symptoms, and now they can't get enough opioids, and so they live in an agony to prevent them from, it's an entire mess. and there's a few people running around, with nice flashy cars, and my line is,
Today he wants
their
to go and
flashy
get around.
car is your pain.
Around.
So yeah, that's so I need everybody to be a little bit of the Incredible Hulk, permanently angry about this, and say this. And so on the website, one of the reasons I focused on scoliosis, A, because it's my thing and I had it.
Yeah.
But B, it's also really visible.
Mm-hmm.
So, for instance, and this is also wonderfully visible stuff, but I've got lots of videos where there's a video of me interviewing somebody, a fix, and it's somebody's 30 years in agony. They damaged their back in the war in Bosnia, a landmine incident. I mean, you can check it through. It is correct, but a casual observer might go, how many videos of some bloke saying, "Oh, I had back pain, it's gone." You see, the scoliosis, it's, unless I'm a world expert in Photoshop, and I'm not, you see back to do this, and you go, that's okay. And the rest of it, the chronic fatigue syndrome, the migraines, the tinnitus, all the other bits and pieces of the back pain, is sort of, I have that as the base that says, if I can do that, that gives it the legitimacy that when I'm saying it does all these other stuff as well, I'm not doing that isolated, which would have a problem in terms of legitimacy. And so these things are obvious, and the scoliosis surgeons can see them, the patients can see them, and a lot of people say, "Oh, I want that therapy," like you have, but an awful lot more will say, "Oh, I better check with my doctor," and the doctor says, "No, I've never heard of it," and that's the phrase they use. I've never heard of it.
Yeah, it's unbelievable.
So every time I see a doctor, I say, "London's the capital of England," and he says, "Why are you telling me that?" I say, "You only like to hear things you already have heard about, apparently."
Yeah.
So yeah, yeah. So that's. I'm ranting, but it needs.
Well, here I'll pitch in with a little rant then.
Rant away. Yeah.
Do you remember my story about when I asked my massage therapist why she was so much better than everyone else?
Oh, go on. Yeah.
So I have been to a number of massage therapists trying to solve this, and there's only been one person the entire time who I have felt like she reached into my body and did exactly what needed to happen, and took me out of pain. Didn't go deep tissue where she shouldn't have. She had the nuanced approach to actually do the right thing, instead of where you hear these people, "Oh no, don't do deep tissue, don't do this, don't do that." And I'm sure there's some truth, and like with your philosophy, there's possible, we're just trying to drain lymphs. So all I had to say to Sheena, drain the lymphs. She knows what to do. She goes out on the whole back. She feels around and she does the thing. And so throughout my treatments, I've just been in awe of her attention to detail, her capability, and just everything about her approach. And so one day I was getting a massage and I said, "Okay, what's the deal? Why are you so much better than everyone else?" I couldn't resist. And she just laughed and she said, she didn't even pause. She's like, "I think it's mostly frustration." And I was like, "Go on." And she says every time she gets treated, she's always in her head thinking the practitioner moved on before they should have, or didn't chase something where they should have. They just didn't have that nuanced attention to detail. And so she says that the reason she's so good is literally because she's frustrated, just like you.
Right.
Yeah.
I'd like to get one of her to show her stuff on your back as well.
Yeah, Wednesday we will do that.
Okay, because it sounds like a masterclass in back lymph drainage. I'd love to see it done properly, because I'm a little. I don't tend to do. This is actually part of another part of Dr. Sherwood's protocol is the manual massage of the back to drain the lymph. And if you do it too much, you drive inflammation.
Right.
And if you don't do it enough, you don't get any value.
Okay.
And it's a skill, and some people are better at it than others. And I'd rather not do it than do it badly. But when I see it done properly, it's like watching a ballet. A real craftsperson doing an absolute masterful job. So it'd be lovely to see that done on video.
Yes, I will, if possible, if that chapter is short enough, maybe you could just take some pictures and send it to me so that I can read it before Wednesday. We can talk about it as she's doing it. Otherwise, I've got those books on order, so if they get here in time, then I'll make sure to really look at the Sherwood approach there and make sure that she's not missing anything or whatever. Yeah. Okay, so one more. And now we're getting to the point where in our last discussion, we had talked about going quite around the front here. I don't know if we have the pads for it, but we will try that.
Well, I just won't flip
Okay, yeah.
Okay.
And which matches a little bit of what you're just saying about chasing things round.
Mm-hmm.
But it's a basic another. It's like if something starts a little bit further around the corner, has got a grip there, just chase it round a little bit further. If it isn't an issue there, big deal.
Okay.
And if it is, it can be quite useful.
Right.
What milliwatts what milliamps did we get to on that last?
I haven't done anything below 28 today.
Wow, this is really good. It's when you get 25 to 35, you really get the kind of like progress.
Okay,
It's nice that you've taken a couple of days to build to that.
Yeah,
is really good, so you don't get too much flare up. So you've done this really. I like the way you've crafted this.
Do you want to wrap the back brace around me maybe to hold the pads on? Or you're good? Okay. Another thing I was going to say earlier is that for anyone listening too, even if you don't believe us, and if I claim to be healed at the end of this, I am healed. And if that happens, I am taking these devices and I'm going around and I will heal my friends. I don't care if you believe me or not, but I am going to be so liberated, and I'm going to go around. I'm going to, I have a lot of people, because I'm in the film industry, I have a lot of people that aren't comfortable standing for 20 to 30 minutes anymore because of their back pain that's been mounting over the years. And if I can go take one of those people and extend their standing time for their workday, that is a win for me. So that's where this will go.
Okay.
Yeah.
More videos to come.
Mm-hmm.
I'm curious about how I can utilize it in my work.
Well, you are a different type of healer, so you can utilize it by.
I know, but it's like if we're just breaking up lymph and breaking up toxins, then it applies.
Mm-hmm. So I'm getting a much stronger activation on the right side this time around the front, which is interesting, eh?
Yeah.
Because the right side's dead on the back, it's stronger on the front. It's sending me now to the left. And I'm only at 15. We'll see if I can get above.
Okay. And again, it's the first time you've done that, so
yeah. I'll wait for I just need to see what the squeeze is going to do to me before I go up. But the pulse, I can go up. Yeah, we'll be fine. Oof. And there is, like, I'd say once you go over 20, it does turn in, for me anyways, to that numbing electric buzz.
Okay. Now, I always find you get a better umph. Well, and we'll get that in a couple of these times when we have 2 rows of pads on, because it extends a little bit further of the muscle, so not just one part of the muscle, because big long muscles and tendons in the back.
Mm-hmm.
Get to cover a bit more area.
So
this is why we weight the pads.
Oh man, it's so interesting to feel the different muscles firing differently, like between the back and the front, right? There's no well, I'm sure there is actually a rhyme or reason here, but yeah, like right now my left, whatever muscle that is on the far outside, is that the oblique? That is not firing on my left very strong right now. But on my right, it's going all the way into my pec and my shoulder.
Right, okay.
Yeah.
Yeah, I mean, feeling the squeeze classically all the way through to the abdomen is a good indication that you're at a good level.
Okay.
Yeah, that's all stuff. Decent. It is 25 past 6. I've got a therapy at 7, so I've got to drive over to the therapy room.
Okay.
So I'm gonna have to take my leave.
Yeah.
And I'll leave you guys to get on with that one.
Okay, yeah, tomorrow will be similar to today, and I will send you messages with a schedule as well. She's looking to do, she just sent me a note, Tuesday, Thursdays, 8 a.m. PST, which would be 1600 your time. So,
okay.
Yeah, 4 p.m.
If you stick that on a note to me, I'll check my diary and see if we can.
Okay.
I can join in
sure.
on that one.
Yeah.
Right,
and
okay.
Thanks so much, Damien.
Catch you, Henry.
Until next time.
Bye, bye.
Thank you, everyone, for making it through the episode today, and I hope you learned a lot from Damien. There's a lot more interesting stuff to come, so don't forget to follow and subscribe. Bye for now.